Hello, I'm Dr. Soran Hassan Zangina. I'm a specialist of internal medicine. In this video, I'm going to talk about this is the first video of a series of videos about diabetes mellitus. For this video, we will talk about what is diabetes mellitus and what are the main types of, or the most common types of diabetes mellitus. Diabetes mellitus is a disease, a group of diseases that are characterized by that the body cannot handle glucose well, which leads to accumulation of glucose in the bloodstream and over time causing complications. The main source of glucose that we have is either from the foods that we eat, including the carbohydrates, which all of them eventually will go to be glucose, or from the liver. Whenever the blood sugar blood sugar goes down, the liver compensates for that by degrading glycogen to produce glucose. The hormone which is responsible for glucose utilization by the body is called insulin. Insulin is secreted by the pancreas. The insulin is a key that is mandatory for the entrance of glucose from the blood into the cells, and after that to be utilized, the glucose to be utilized by the cells to produce energy. The most common types of diabetes, we have three most common types: type 1 diabetes, type 2 diabetes, and gestational diabetes. There are other less common types that are quite rare if compared to the most common types, for sure. The first type, which is type 1, which is an autoimmune disease in which the body does not produce enough insulin for the requirements of the body. The pancreas does not produce enough insulin. The type 2 diabetes, we have two issues. First of all, the cells of the body have resistance to the hormone insulin, and the pancreas is not producing enough insulin to overcome that resistance. The third type 2 diabetes composes actually 90% of all types of diabetes mellitus, or patients of diabetes mellitus. The gestational diabetes, it's a state of diabetes that occurs during pregnancy, which is the pathophysiology is similar to the type 2 diabetes, and the cause here are the hormones of pregnancy. Usually patients who develop gestational diabetes, some of them after delivery they return to normal, some of them return to normal but eventually at their lifetime develop type 2 diabetes mellitus. But unfortunately, some of them also remain diabetic even after delivery. For any questions, you can write it in the comment, and we will try to answer them as much as possible through the comments or in the next videos. Stay safe.